Assalamu alaikum. Today we'll be talking about the femur. Now, the femur is the longest and heaviest bone in the human body. This bone is present in the femoral region or in the thigh of the lower limb, and it is characterized by the presence of an upper end, a lower end, and a shaft in the middle. So, whenever we're talking about the anatomical position of the femur, the lower end has two condyles, right? So, there is a medial condyle and a lateral condyle. So, when these two condyles are placed on a horizontal surface, the shaft is present in an oblique fashion. So, it is not directly vertical but at an angle. And the head, this is known as the head of the femur, and the head is directed medially upwards and slightly forwards. At the same time, the shaft is curved anteriorly, so it is slightly convex forwards. So let's start with the upper end of the femur. The upper end has a head. It is about 2/3 of a sphere. It's obviously not a complete sphere. Then there is the neck. This is the neck. After that, we have a greater trochanter and a lesser trochanter. Right, so this is the anterior view of the upper end, and here you can see the posterior view of the upper end. Now this is the head. This is the part which actually articulates with the acetabulum of the hip bone, right? So this is the ball part of the ball and socket joint. So this head, which is about 2/3 of a sphere, more than half of a sphere, in it there is a pit or a depression. This is known as the fovea capitis. This is the fovea. This pit is for the ligamentum teres. Now, in early years of life, in childhood, this ligamentum teres actually within it carries an artery which supplies the head of the femur. We'll talk about the blood supply of the head and neck of the femur, which is very important, in detail later on. So after the head, we have the neck of the femur. The neck of the femur is slightly narrower medially. Towards the head, it is slightly narrower, and towards the shaft, it is slightly wider. The neck has an upper border, a lower border, and an anterior surface and a posterior surface. Now, the upper border is So the upper border of the neck is it's much more straight. It is concave, more concave as compared to the lower border, and it meets the shaft at the greater trochanter, right? So this is the shaft, and the upper border of the neck meets the shaft at the greater trochanter. The lower border of the neck, this one, is more oblique as compared to the upper border, and it is more concave, and it meets the shaft at the lesser trochanter. So this here is the anterior surface of the neck, and this is the posterior surface of the neck. Now, the anterior surface of the neck is flat, and it meets the shaft at the intertrochanteric line. So here we have a slightly raised ridge, which is known as the intertrochanteric line. This is the posterior surface of the neck, and the posterior surface of the neck is convex from above downwards, and it is concave from side to side. It meets the shaft at a much more prominent and raised ridge, which is known as the intertrochanteric crest. So anteriorly we have the intertrochanteric line, and posteriorly we have the intertrochanteric crest. The anterior surface of the neck is entirely, all of it is intracapsular. And when we talk about the capsule, it means the capsule of the hip joint. The posterior surface, not all of the posterior surface is intracapsular, but a little more than half of the medial part, right? So if you divide the posterior surface into two equal halves, then the medial part plus a little bit more is intracapsular, and the lateral part, a little bit less than half of the lateral part, is extracapsular. So at this time, I think it's important to learn about two angles known as the angle of inclination and the torsion angle. Let's talk about the angle of inclination first. The angle of inclination is actually the angle between the long axis of the neck of femur and the long axis of the shaft of femur, right? So if an imaginary line passed through the center of the neck of the femur and another imaginary line which passed through the center of the shaft of femur, then the angle between these two lines is known as the angle of inclination. It ranges from 115 degrees to 140 degrees. It is about 126 degrees on average. The angle of inclination is more in childhood, and as you grow older, this angle decreases. When it comes to the difference in males and females, this angle is greater in males, and because of wider pelvis in females, it's a much more acute angle, right? So the angle is smaller. So the second angle that we need to talk about is the angle of anteversion or the torsion angle. Now let's imagine we're looking at the femur from the bottom, right? So this is the lower end of the femur. These are the two condyles. So this is the medial condyle, and this one here is the lateral condyle, right? So the femur is lying flat on a horizontal plane, right? So if we pass a line through the two condyles, right, and then another line, again, the same one that we talked about in the previous, when we were talking about the angle of inclination. So the line which passes through the neck of the femur, or the axis of the neck of the femur. So the angle between these two lines, right? So a line which passes through the two condyles of the femur, and then the axis of the neck of the femur. So the angle between these two lines is known as the torsion angle. And this torsion angle is about 10 to 15 degrees in adults. So here you can see the angle of inclination. This is the angle of inclination in a 3-year-old, right? So it is much greater, right? So in adults, this angle of inclination between the shaft and the neck of the femur is about 126 degrees on average. And as you grow older, in elderly, this angle decreases further. And here, this shows the angle of inclination in old age, so it becomes about 120 degrees. Over here, you can see the torsion angle. This picture shows the femur from the top, okay? So this is the upper end, and you obviously can't see the shaft, and then this is the expanded lower end here. So this is the upper end, and here you can see the head, the neck, and the greater trochanter. So instead of being in line like that, because this is the line which passes through the two condyles of the lower end, instead of being in the same line, the neck is slightly at an angle, right? So instead of being like that, it is at an angle, and this angle is known as the torsion angle, and it is about 10 to 15 degrees in adults. So after the head and the neck, let's move on to the two trochanters. So this is the greater trochanter, this one here, and this is the lesser trochanter. You can't really see it from the anterior view, but you can see it here on the posterior view. This is the lesser trochanter. So the greater trochanter has an apex, right? So this is the apex here, it is a slightly pointy part. So this is the apex. It has a medial surface, a medial side, which would be towards the head. Then it would have a lateral surface, which would be this one. Here you can see the lateral surface on this side, opposite to the head, and then an anterior surface as well. So this here would be the anterior surface, and posteriorly, here you can see the intertrochanteric crest and then the lesser trochanter here. Right, so this is the apex. Then you have the anterior surface. Now the anterior surface is rough in its lateral part, right? And then the medial surface. Now the medial surface would be here, right? So the medial surface would be here, and here you have a fossa, a deep fossa known as the trochanteric fossa. Now then it has a lateral surface. All of these surfaces are the apex, and the surfaces are of the greater trochanter. So here you will have the lateral surface, and the lateral surface has an oblique ridge on it. The lesser trochanter is conical in shape, right? And below it is continuous with the line known as the spiral line. Now, as we talked about before, here you have the intertrochanteric line, and here you have the intertrochanteric crest. Right, so after that we'll move on to the shaft of the femur. Now, for academic purposes, just to study it in a better manner, we'll divide the shaft into three parts. It is obviously a continuous shaft, but we will, for study purposes, divide it into an upper third part, a middle 1/3 part, and a lower 1/3 part. So let's start with the middle 1/3 part. The middle of the shaft, right, which would be about this much. So the middle 1/3 of the shaft has 3 borders and 3 surfaces. Now, posteriorly, there is a posterior border. This is a very prominent ridge known as the linea aspera. Linea aspera just means a roughened line, right? So this here is the linea aspera, and the linea aspera has 2 lips. So it has, on the lateral side, it has a lateral lip, and towards the medial side, it has a medial lip. Other than the linea aspera, which is forming the posterior border of the shaft, you have a medial border and a lateral border. Now these 2 borders, the medial and the lateral border, are not very distinct. In fact, they're quite curved. It also, the middle 1/3 of the shaft has 3 surfaces. So between the medial and the lateral border, we have the anterior surface, and between the medial and the posterior border, we have the medial surface, which would actually be the posteromedial surface, and between the lateral border and the posterior border, we have the lateral surface, which faces posterolaterally. Now let's move on to the upper 1/3 of the shaft of the femur. Now in the upper part of the shaft, this linea aspera, the 2 lips of the linea aspera actually diverge, which you can see here. So in the upper 1/3 of the shaft of the femur, these 2 lips of the linea aspera diverge, and as a result, there is formation of 4 borders and 4 surfaces. So you will have a medial and lateral border, and then you will have a spiral line here, and you will also have the lateral lip, which is then continuous above with the lateral lip of the gluteal tuberosity. This part here is known as the gluteal tuberosity, and it is in fact the part where there is insertion of the gluteus maximus muscle. After that, we move to the lower 1/3 of the shaft of the femur. Again, in the lower 1/3 of the shaft of the femur, the linea aspera again diverges into 2 borders, right? So the 2 lips of the linea aspera diverge into two borders, and these in fact form the supracondylar lines or the supracondylar ridges in the of the femur. So as a result, again in the lower part, we have 4 borders and 4 surfaces, right? So you'll have a medial border and a lateral border, and posteriorly, on the posterior aspect, you'll also have the supracondylar lines, and as a result of the 4 borders, you'll have 4 surfaces. So you'll have an anterior surface, you will have a medial surface, here you'll have a medial surface, again a lateral surface, this would be the anterior surface, and then posteriorly you have a surface between the two supracondylar lines. This surface is known as the popliteal surface, and this popliteal surface is in fact forming the floor of the popliteal fossa, just like the cubital fossa in the upper limb. On the posterior aspect of the knee joint in the lower limb, you have a fossa known as the popliteal fossa. After the shaft, we move on to the lower end of the femur. The lower end of the femur is characterized by the presence of 2 condyles, and these are the 2 condyles. So here you have the lateral condyle, and here you have the medial condyle, and this is the anterior view of it. Posterior view of the 2 condyles, this is the medial condyle and this is the lateral condyle. Anteriorly, these 2 condyles are pretty much in line with the shaft or the surface of the shaft of femur, but posteriorly these 2 condyles project backwards quite a bit. So they're quite so they project out of the main surface or this shaft of the femur. So here you can see the 2 condyles, although there is a presence of a few muscles here as well, but posterior aspect of the femur shows that the condyles project backwards quite a bit. Then on the medial aspect of the medial condyle, you can see the medial epicondyle here, and on the lateral aspect of the lateral condyle, you can see a prominent lateral epicondyle here. Now on the posterior view shows that these 2 condyles are divided from each other by a deep intercondylar fossa, right? And this part here is known as the intercondylar notch. So this here is the lateral condyle of the femur. On the lateral aspect, this is much more flat. It is more in line with the shaft as compared to the medial condyle. So the medial condyle also projects medially much more than the lateral condyle projects laterally. And the lateral condyle takes greater part in transmission of the body weight to the tibia. Now here the lateral is the lateral epicondyle, and on the lateral epicondyle, just beneath the lateral epicondyle, there is a groove which is known as the popliteal groove. So you can see the popliteal groove here, right? So just beneath the lateral epicondyle, you can see the popliteal groove, which in fact carries the tendon of the popliteal muscle passes through this groove. So when it comes to the medial condyle is not as much in line with the shaft as is the lateral condyle, and the medial epicondyle just above here, you can see there is a tubercle which is known as the adductor tubercle. So when it comes to the articular surface of the lower end of the femur, you can see that the anterior parts of both the condyles, the medial and the lateral condyle, they take part in articulation with the patella, right? So there's articulation with the patella anteriorly, and the patella is actually a sesamoid bone, which we'll study in detail later on, and the inferior as well as the posterior aspects of these two condyles articulate with the condyles of the tibia.